Hello students, welcome to Sports Plus. So today we are discussing about the question and answer of chapter 3, that is yoga and lifestyle. So today we are discussing subjective question and answer. So that question is a little bit twisted and little bit difficult. So why I have twisted the question? Because when you sit in the examination, that time they will ask the twisted question, so you should be able to give the answer there. So that's why I have twisted the question. So now if you want notes of the term 2 examination, so our app is there that I have only created. That app you can download from the Google Play Store, and the link of the app is given in the description below. You can check there. Okay, so now if you have not subscribed our channel, please subscribe it and share it with your friends, so they will get also benefited. Okay, so without delay, let us start. If you have any query, let me repeat first, if you have any query, let me know in the comment section. So let us start. Hope you will enjoy the video and share your valuable feedback in the comment section. So let us start.
So let us start with the first question. The question is, performing regular asanas helps bone and joint to be strong. Justify. So we have to justify how performing regular asana our joints and bone become strong. So you know that yoga is a weight bearing exercise, which means you hold the weight of our body up against gravity. So this puts mild stress on the bones and keep them strong. Unlike other weight bearing activity, yoga does not damage cartilage or stress the joints. Instead, it helps to strengthen and maintain body health, relieve stress, improve balance, and thereby reduce the likelihood of falls. So here two things are there. One thing is that whenever we are doing some weight bearing exercise, it will put lot of pressure on our bones. But yoga, whenever we will do the yoga exercise, it won't put that much pressure on our bones. And same way, whenever we will do weight bearing exercise, when the pressure we will put on the bone, same pressure go up to the joint. So yoga cannot put the more pressure on the joint. So slowly and slowly it will improve our joints and bones. Okay, so it will help to strengthen our joints and bone. So let me explain you a little bit more. Tadasana and Chakrasana involves 3 different movements like upward stretching, lateral stretching, and twisting of the bone. Trikonasana helps in developing strength in our body structure. So Trikonasana, what it will do, it will help to give a strength in the body structure. Okay, backward bending asanas such as Bhujangasana, Dhanurasana are excellent to relieve back pain and strengthening the spine. Surya Namaskar, you know the Surya Namaskar, which involves the 12 position, is a complete practice for bone strengthening. Thus we can say, after performing regular asana, our bones and joint become strong. Okay. So here is a question number 2. How do asana help improving blood circulation? So by performing asana regularly, the stroke volume as well as cardiac output increase, because cardiac muscles start working more strongly and efficiently. So what will happen when you do the yoga? Our cardiac muscles start working more strongly and efficiently. The result of that, our stroke volume and cardiac output increase. Okay, blood circulation become proper and blood pressure normalizes and stabilizes. So regulated breathing oxygenates the blood and assists fresh nutrients to reach all peripheral vessels and capillaries. Improved circulation means that brain receive more oxygen. So when our brain receive more oxygen, the result of that is improved alertness, memory, and mood. It will improve the alertness, our memory, and mood. Sometime whatever the decision we have to take, so that will help us to take the strong decision sometime. Okay, other vital organ also receive a steady supply of nutrients they need for optimal functioning. So those who are other nutrients, they will go properly into our body, so our body can function properly. That's why we can say asana help to improve blood circulation. Question number 3. Asana help boosting immunity. Is this a myth? Explain with example. So by a regular practice of asana, our immune system is strengthened. As a result, our body become less prone to the disease. So lack of sleeps, poor nutrition, and life stress all lead to a weakened immune system and vulnerability to disease. Stress more than anything leads a breakdown in the body ability to defend itself against bacteria and virus. Now we will come to know here what is the cause of the this weakened immune system, cause of the disease. So that is the stress is the cause of many disease in our body. Okay, when stress, the hormone cortisol stay in the blood for extended period of time, leading the increased inflammation. When this hormone is there in our body, so whatever the medicine we are taking, it won't give that much effect. Okay, we can say in that way that. So yoga calm the mind and contribute to a deeper regulated sleep, which is crucial for the wellness. So yoga what will do, calm our the body and provide you the deep sleep, which will help you to relieve to the stress, and ultimately it will help you to the boosting immunity. Okay, so that is the answer of this question. Question number 4. Asana help improving the efficiency of respiratory organs. Explain. So you know the respiration is two-way process, supplying oxygen to every cell in the body and then transporting carbon dioxide, the waste product of respiration, out of the body. Lungs have the important function of drawing in the oxygen, moving it into the bloodstream, extracting the carbon dioxide from the bloodstream and removing it from the body. Most people are habitual shallow breathers and do not use lungs in their full potentials. So many people do not use their lungs in a full potential. If they will do yoga, so they can use their lungs in a full potential. Yoga introduce like meditation and this pranayama breathing technique that will help you to use our lung in full capacity. So by performing asana regularly, the respiration organs become efficient. The vital air capacity increases up to 6000 cc. The size of the lung and chest also enhances. Thus we can say when we will do asana, our respiratory organs will improve. Okay. Question number 5. How do asana enhances the efficiency of excretory system? By regularly performing asana, the efficiency of excretory system enhances. As a result, the waste products such as lactic acid, acid phosphate, urea, uric acid, etc. are excreted quickly and properly, which is turn help to delaying fatigue. If these products like lactic acid and acid phosphate are removed our body quickly, it will help us to delay the fatigue. We can do more activity for more duration of time or longer duration of time. As you know, food is digested in the digestive tract and nutrients are absorbed in the blood and waste is thrown out of the body. If the excretory system is not function properly, the waste from the body is not thrown out completely and gets accumulated, leading to the problem in the digestive system, urinary system and excretory system. If the waste product does not go out from our body, it will start accumulating in the digestive system, urinary system and excretory system. So Pavan, Muktasana and other loosening movement helps to releasing toxin from the body. So it will help you to all the whatever these type of lactic acid and acid phosphate to remove it from the body. So thus we can say yoga can help to enhance the excretory system. Question number 6. How are muscular tissues strengthened by performing asanas? So by performing asana regularly, the muscle of the body becomes strong. The efficiency of the muscle increases. Fat does not accumulate in the body. In fact, the appearance of body enhances. The size of the muscle also increases. So musculoskeletal system provide a frame to support the body and to enable it or move. So you know that muscular or skeletal system provide a framework of our body that will help us to move. Okay, whenever any movement required in our body, it will require for the musculoskeletal system. Because of that only we are able to do the movement in our body. Muscle, tendon and ligament act on the bones to give body its shape and posture. Muscle work is that it will give the shape of the body. Okay, and whatever the bones are related, skeletal system gives shape of our body and muscle will enhance that shape. Okay, yoga asana can help redress problem associated with the poor body posture and affect the structural decay. So if we have any postural deformity, yoga asana can help to cure that deformity, as we have studied in the chapter number 5. Thus we can say yoga asana, if we will do yoga asana regularly, that muscular tissue can be strengthened. Okay. Now the question number 7. What do you understand by the term lifestyle disease? Okay, lifestyle disease are ailments that are primarily based on the day-to-day habits of people. Habits that detract people from activity and push them toward the sedentary routine can cause several health issues that can lead to the chronic non-communicable disease that can have near life-threatening consequences. So here, what is the meaning of that? Whatever work you are doing, might be your job, and related to that, whichever the problem you have, that we can call the lifestyle disease. The way you live your life, in that many problem will come. Sometime might be you are going to the office, you have a sitting job. In that sitting job, you will get a lot of fat and lot of problem, might be spinal problem or something problem. For that problem, it is not for you are having that problem. Because of your profession, you get that disease. So that's why we call it the lifestyle disease. With your lifestyle, whatever you are living your lifestyle, as per that, because of that you got your disease. That's why we call it the lifestyle disease. Question number 8. What are the differences between yoga and exercise? So very important question. Sometimes they will ask this question. So yoga and exercise, might be somebody think it is the same, but it is not same. There are some important difference. I am going to tell that difference. So yoga practice slow motion dynamic movement. Yoga practices will lead you to slow and dynamic. Whenever we do the yoga, it will be the slow and dynamic movement, but the exercise is the rapid fast. So it will be a rapid forceful movement. Okay, we are doing exercise very fastly. Low risk of injuries, muscles and ligaments. When we will do the yoga, injury of the muscles will be very low. Okay, risk of the injury of muscle is very low. Inside the exercise, injury have the higher risk of injury, because we don't know any time injuries can happen. Okay, yoga leads to relatively low caloric consumption. When we do yoga, might be your calorie will consume very low calorie, but exercise, whenever we do the exercise, the energy consumption will be very high. So let's go to the next. So now next is yoga is non-competitive, process oriented. So yoga is a process oriented. It's not a competitive. Okay, exercise is commonly competitive and goal oriented. We want to win, that's why we have to do the exercise. Okay, yoga is anabolic, which conserve energy. So yoga which conserve energy. Exercise is catabolic, which is capable of breaking down the energy. Okay, next is the yoga stimulates parasympathetic nervous system, hence relaxing. So it by relaxing you can do the yoga, but exercise stimulates sympathetic nervous system, hence tiring. It is a very tiring thing. Okay, whenever we will do the exercise, you will get tired, but yoga you won't get that much tired. Yes, then yoga also exercise the slow stretching exercise. Yoga is a slow stretching exercise. That exercise is a fast pace. So that's why these are the differences between yoga and exercise. You can write there. Okay. Question number 9. What do you mean by obesity? Obesity is a complex disease involving an excessive amount of body fat. So it means excessive amount of fat get accumulated in your body, that we can call obesity. Okay, so if you have obesity, it is the invitation for the other disease. So with obesity, other disease will get very fast. So what are the other disease? Might be heart disease like diabetes, high blood pressure, or certain sometimes cancer also. Okay, obesity is not a cosmetic concern. It is a medical problem that increases your risk of other disease and health problems such as heart disease, diabetes, high blood pressure and cancer also sometimes. Obesity is the condition of the body which the amount of fat increases to an extreme level. Where is the extreme level means after that you might got the condition of death also. So here is question 10. Might be they will ask you for the 2 marks question. What are the causes of obesity? So obesity not for the one cause. It have many causes like genetics. Might be your parents also have obesity. You also get from them. overeating. If you eat more, excessive eating also the cause of obesity. Frequency of eating, if you eat frequently many things, so might be now you eat something, after some time something else, or junk food or something else, so that also frequency of eating will cause the obesity. Physical inactivity, if you are not doing any physical activity, so that also lead you to the obesity. Or psychological factor, so if you are psychologically, you are not that much matured, you have a stress, that might be obesity also get in that stress thinking also. If you are in the stress, you will get the obesity. Okay, that are the causes of obesity. Question number 11. How does BMI helps to clarify a person to be obese? How does BMI tell you the person is obese? Obviously, because we have a table, that graphic indicator, that we can tell that this table is a that we can tell that person is obese or not by the based on measuring the height and weight. So BMI is a reliable indicator of body fatness for most people. It is used to screen for weight categories that may be lead to the health problems. Body mass index is measure of body fat based on the height and weight that apply to adult men and women. So we are going to measure the height and weight of the person. According to that, we can tell the people are fat or not. How we will tell? That is a table is there, BMI table is there. According to that, those who are a healthy weight, that may be 18.5 at 24.5. So indicator should come like that. So how we will divide that? Weight upon height square. Okay, so that is the formula of BMI, that we will come to know the person is obese or not. Number 12. Asana as preventive measure of obesity. Which are the asana that will help you to prevent the obesity? So here I made a little bit shortcut. So you should remember what? VATH. So VATH, that short form you can remember. After that you can apply in the full form. So what is the what here? V for Vajrasana, A for Ardh Matsyendrasana, T for Trikonasana, H for Hastasana. These are the 4 asana that will prevent from the obesity. So that is procedure and all the things you will find out in the textbook, or you can find out in the notes which I have given in the app. Okay, so that's why I am telling, remember this what? VATH. So you want to forget the asanas. So if you know the what, VATH, what means? V means Vajrasana, Ardh Matsyendrasana, Trikonasana and Hastasana. Like that you should prepare. Okay. Question number 13. How Vajrasana prevent obesity? So there is a most important question. So we know that Vajrasana prevent the obesity. Now there is the question how. So Vajrasana stimulate the Vajra Nadi, which facilitate good digestion. It helps to relieve the scatia, nerve tissue and indigestion. When you sit in a Vajrasana, you obstruct blood flow to the lower part of your body, thighs and legs. This increases blood flow to your pelvic area and stomach, due to which bowel movement and digestion become better. It aids liver functioning as well. What will happen when you sit in the Vajrasana position? So it will block the blood flow to the lower version of the body. So blood will become in the stomach area. So it will function very fast. Okay, so due to this movement of digestion become better. Okay, so that's why we can say Vajrasana prevent. This is the way that Vajrasana prevent our obesity. So question number 14. What do you know about diabetes? So diabetes is such a disorder that is caused sugar to build up in our bloodstream instead of being used by the cell of our body. Okay, diabetes is commonly known as metabolic disorder characterized by high blood sugar level over a prolonged period of time. When in the blood our sugar level become high, that we can say we have the diabetic. Okay, so there is also 2 type of diabetic. Type 1 diabetes is your pancreas does not make insulin. Our pancreas, there is a pancreas like of gland that will make the insulin. So it will stop to make the insulin. That is the type 1. So type 2 is there diabetes, that is pancreas still make the insulin, but our body does not respond to it normally. Means our body did not use that insulin. So that is the type 2. Type 1 is your pancreas does not make the insulin. Okay. Second is your pancreas will make the insulin, but your body cannot use that insulin. So that is the type 2 diabetes. So type 2 diabetes. So total meaning of diabetes is when the sugar level is increase in your blood. So that is you have the diabetes. That is the meaning of diabetes. Type 1, type 2 I told you already. So question number 15, asana as preventive measure for diabetes. Which are the asana that will cure the diabetes? So here is the short form ABP PM. ABP PM. ABP news you know, our PM you know. That is the short form of that asana. A for Ardh Matsyendrasana, we also study in the obesity in. B for Bhujangasana. P for Paschimottasana. So that's why 2 P are there. P or PM. Single P is Paschimottasana, PM is Pavan Muktasana. That's why I kept it the PM in that. So here you have to just remember ABP or PM. It means ABP and PM. A means Ardh Matsyendrasana, B means Bhujangasana, P means Paschimottanasana, and PM means Pavan Muktasana. These are the 4 asana that will help you to prevent diabetes. Question number 16. What is asthma? Write the symptom of asthma. So asthma is a disease of lungs in which the airway become blocked or narrowed, causing difficulty in breathing. The airway also swell up and puke extra mucus. It usually triggers coughing, wheezing, whistling, or shortness of breath. The coughing usually occurred at night or early in the morning. Okay. So we can say asthma is a chronic or long-term condition that affect the airway in the lungs. The airway are tubes that carry air in and out of your lung. If you have asthma, the airway can become inflamed and narrowed at time. This makes it harder for air to flow out of your airway when you breathe out. So that is the asthma. Okay. So now what is the symptom of asthma? Shortness of breath, chest tightness or pain. We will have sometimes chest tightness and pain also in the chest. Wheezing when exhaling while in a common sign of asthma in the children. Trouble sleeping. So when we have asthma, we have a trouble in sleeping because shortness of breath, coughing and wheezing. That are the symptom of asthma. So here is the question number 17. What are some early warning sign of asthma? So following are the some early sign of asthma. Frequent cough, especially at night. If you have frequent cough in the night time, so better to check up. Losing your breath easily or shortness of breath. If you lose your breath easily or you will feel shortness of breath. That means there is the symptom of sign of asthma. Feeling very tired or weak when exercising. Wheezing or coughing after exercising. When you do the exercise, after that you have wheezing or coughing. So that we can lead to the asthma. Feeling tired, easily upset, crossy and moody. Okay. Decrease or chances in lung function as measure of the peak flow matter. So sign of a cold or allergy, sneezing, running nose, coughing, nasal congestion or sore throat. That are the sign of asthma. And troubling sleeping because of you will get shortness of breath, so you will feel trouble of sleeping. That are the early sign of asthma. So here is the question number 18. Asana as preventive measure of asthma. So now which are the asana that can prevent the asthma? So here the short form what I have given, SPG, BMC or PR. So it means SPG, Special Protection Group, you can say SPG, BMC, Bombay Municipal Corporation. Here for remembering purpose I am saying, or PR. So SPG, BMC, PR. This short form you should remember. So S means Sukhasana, P means Paschimottanasana, G means Gomukhasana, or B means Bhujangasana, M means Matsyendrasana, C means Chakrasana, or PR means Parvatasana. So these are the asanas that will prevent from the asthma, that will prevent you from asthma. So these are the short form, you can remember it easily. SPG, BMC, PR. So that is the for asthma you have to remember. Okay. So question number 19. What do you understand by blood pressure? Okay. Blood pressure is the pressure of blood pushing against the wall of your arteries. Arteries carry blood from your heart to other part of your body. blood pressure is measured using two numbers. So the first one number is called systolic blood pressure. Measure the pressure of your arteries when your heart beats, when your heart is beating. One is when your heart is functioning or beating properly. Second is called diastolic blood pressure. Diastolic pressure means the measuring of your arteries when your heart rests between the beats. When your heart is in the resting mode, after beat your heart will rest na, so that time we will measure it. So if the measurement reads 120 systolic and 80 diastolic, you would say 120/80, or while 120/80 mmHg. So that is the normal condition of the 120 or 80. If you have blood pressure higher than 130 or 135, that is a dangerous thing, or lower than 80 also is a dangerous thing. So that is the blood pressure. So question number 20, what is the main symptoms of hypertension? So high blood pressure usually has no warning or no symptoms. That's why we call it a silent killer. It won't have any warning, any symptom, and many people do not know they have the blood pressure, okay, or hypertension. If your blood pressure is extremely high, there may be certain symptom or look out for, including severe headache, nosebleed, fatigue or confusion, vision problem, chest pain, difficulty in breathing, irregular heartbeats, blood in urine, or pounding in your chest, neck or ear. Sometime might be you have this type of symptom, but largely few people will get this type of symptom, but largely there is no symptom of the hypertension. Question number 21, what is the main cause of hypertension? What is the main cause of blood pressure? Common factor that can lead to the high blood pressure include a diet high in salt, fat and cholesterol, chronic conditions such as kidney and hormones problem, diabetic and high cholesterol, family history, especially if your parents and other close relatives have high blood pressure, lack of physical activity, old age. The older you are, the older may get to the high blood pressure. So okay, so commonly those who have this type of problem, common factors are if you take high salt of diet, taking too much salt in the diet, so that is one of the cause of hypertension. Chronic condition, kidney, if you have kidney problem, liver problem or diabetic you have, then you also have the chances of high blood pressure. These are the common thing to have the high blood pressure. So being overeating or obese, okay, or sometimes smoking, so some birth control medicine or other medication, if you take too much medication, that also one cause of the hypertension. Stress, tobacco and drinking too much alcohol, also one of the cause of the hypertension. So if you are taking these type of things, please avoid, otherwise you will get the hypertension, okay. So question number 23, asana as preventive measure of hypertension. So here is the BSV, PM, AC, TD. So this thing you have to remember, BSV, PM, AC, TD. So B means Bhujangasana, S means Shavasana, or V means Vajrasana. PM means Pavan Muktasana, that already we know the PM meaning. AC means Ardh Chakrasana. TD means Tadasana. These are the asana that can prevent the hypertension. So question number 24, asana at preventive measures. If you know that first two sixth question are dealing with this question only, asana as preventive measure, I have twisted little bit that question. So now here asana can be preventive measure as they provide physiological benefit which ultimately help to avoiding various lifestyle disease. Whatever the lifestyle disease is there, if we will do proper asana, that we can prevent that lifestyle disease. So which are that disease that can be prevented through doing asanas? So that I am going to tell following are the disease. So here is the answer. Number 1 is bones and joint become strong. Second is circulation of blood become normal. Third is immune system is strengthened. Fourth is respiratory organ become efficient. Fifth is efficiency of excretory system enhances. Sixth is muscle become strong. If you see it carefully and go to the question number 1st to 6th, all question are same. here this is in the headlines. There I have explained it all, so there here no need to explain it again. Please refer to the question number 1 to 6. There I have given the detailed explanation of these questions and answer of these questions. So that's all for today's session. So if you haven't subscribed our YouTube channel, please subscribe it. If you have any query or any doubt regarding the question and answer, please let me know in the comment section. So with this, we came to end of this session. Take care, goodbye, and see you in the next video. That video will be of the unit number 4, that is physical education and sports for the children with special needs, CWSN. So till now, take care, goodbye, and Jai Hind.